Hello, everybody, and welcome to Medicine and Science on the Pod TV network. I'm Nick Palavita. I'll be your moderator for today's program. And today we have a very exciting topic to discuss, which we briefly discussed at our last meeting, and that is cancer vaccines and the new developments that take place in this. It's so exciting to see science is moving forward and anti-vaxxers are moving backwards, but that's a whole nother story. My tendency is let's just ignore the backward people and let's move forward in our conversation of what's going on in the new scientific development. So with that, we're going to take a look at cancer vaccines. As an attorney, I'm not an expert or subject matter expert on medicine by any stretch of the imagination. So certainly we need a medical doctor, somebody who is a board certified in internal medicine, and give us a brief outlook about what are the latest developments on cancer and cancer vaccines. And with that, we reached across the other pond, went into Hawaii, and found this gentleman who can give you the answers, and that's Dr. Michael Patmos. Dr. Michael Patmos, welcome to your show. We need a subject matter expert on cancer vaccines. You briefly touched on the last show, but boy, that sparked my interest as what's going on in this particular area, especially with neo-antigen vaccines and some other things that are taking place out there in science land. So let's hear it and see what's going on.
Well, good morning, Nick, and good morning to your audience. Aloha from Maui. It's exciting to be here and to share some information with you. Just in the spirit of full disclosure, I'm a board certified internal medicine doctor with added qualifications in infection control and hospital epidemiology. As a result, I can comment on this subject with some expertise. But what I'm providing for you is not my opinion. It is what I take away from the peer-reviewed medical literature on this subject. And from a course I took recently at Harvard Medical School just last December in updates in internal medicine, where cancer vaccines and messenger RNA was discussed and mentioned in particular. So you've asked a fascinating question. Will cancer vaccines work? Well, Nick, I'm happy to tell you we already have cancer vaccines and they do work. The best example of that is the vaccine against human papillomavirus called Gardasil. It's been around for a decade or more. And let me just tell you a little bit about this vaccine. Human papillomavirus is the cause of cervical cancer. Cervical cancer used to be the #1 cancer killer of women until the Pap smear came along and allowed for early diagnosis and treatment. It saved so many lives. But women still get infected with human papillomavirus, and they get cervical cancer still, and mostly now they're treated, and you don't see as many women dying anymore of it. It was the leading cancer killer of women for decades. Well, the vaccine now against human papillomavirus prevents infection with HPV, which prevents the later on development of cervical cancer. All young women are candidates for this vaccine. I have 2 daughters, and I can assure you both of them were vaccinated at the appropriate age. You want to vaccinate your girls before they reach the age of puberty or become sexually active. So we already have cancer vaccines that prevent cancer. The current wave now is realizing that, wait a second, human papilloma vaccine should be given to men as well, boys as well, because they get venereal warts and other kinds of HPV-related pathology, and it's related to oral cancers. So we could prevent a lot of not just cervical cancer, but head and neck cancer as well, if we could just get people immunized with Gardasil. Now, the anti-vax movement has been very aggressively campaigning against Gardasil for years and have scared a lot of people away from it. And it's unfortunate because it is a cancer vaccine and it works. So when we talk about cancer vaccines, it's important to put it into context. Vaccines are a form of immunotherapy. And with immunotherapy, it's a broader umbrella term. What we're doing is we're teaching the immune system how to recognize a foreign antigenic target and turn the immune system on to attack the target. That could be a bacteria, it could be a virus, it could be a cancer cell. And so what we're doing is teaching the immune system how to recognize and attack cancer cells. This is already in widespread use. We already use immunotherapy in breast cancer, prostate cancer, many other cancers, and it's having a very big, profound impact. For those who may not realize it, the long-term survival for metastatic breast cancer has really improved because of immunotherapy. So the notion that cancer vaccines are somewhere off in the future is not correct. We already have them. They're already here. They're already used in, as I said, in immunotherapy is already used in breast cancer, prostate cancer, melanoma, and so forth. Now, where does messenger RNA fit into this? Well, when I took this course at Harvard last December, I was really pleased when the professor and chief of one of the big cheeses at Harvard said there were 5 major breakthroughs in medicine in the last couple of years, and they are messenger RNA, the understanding of the gut microbiome, artificial intelligence in medicine, CRISPR gene editing technology, and the use of psychedelics in psychotherapy and psychiatry. So messenger RNA was mentioned as one of the major breakthroughs in medicine. And the reason why is because with messenger RNA, we can teach the immune system, we can create a specific piece of messenger RNA for an antigenic target, put it into the person, the immune system learns it, reproduces it, creates an immune response, and now the body is geared to go and attack those cancer cells. There's already many very exciting, although preliminary studies using messenger RNA-based cancer vaccines. One just published last week out of the University of Florida, Dr. Ladapo's own institution, the University of Florida, just published an early study of glioblastoma. This is in an animal model using messenger RNA-based vaccine against glioblastoma. It worked, completely eradicated the glioblastoma. As if you know about glioblastoma, you know it's a very unhappy disease in humans, and it doesn't have much effective treatment. It's pretty much a death sentence. Anything we could do in glioblastoma would be miraculous. But there's more. There's other studies from other places using messenger RNA-based vaccines in studies against pancreatic cancer, melanoma. It's very exciting. So much so that in the UK right now, there's a phase 3 clinical trial. That's the final phase of clinical trials, which, if successful, allows for the release or the licensing of a treatment or a vaccination. There's now a phase 3 clinical trial in the UK using messenger RNA-based vaccines as a treatment for breast cancer, prostate cancer, melanoma, pancreatic cancer. These are some very feared cancers. And the fact that we are in a phase 3 clinical trial is very exciting. That means there was good evidence from phase 1 and phase 2 clinical trials. So we're close to a major breakthrough. As I look back on the history of medicine, I think we're at a precipice now of a whole new era in medicine. We are now kind of where Sir Alexander Fleming was when he discovered penicillin, when it was the brink of the antibiotic era. We are at the brink now of messenger RNA-based vaccines for diseases, infections, cancer, autoimmune disease. This is going to be very exciting, and it's coming very fast. I think we will see within a few years multiple mRNA-based vaccines released for various cancers, and it's going to be very exciting, a very exciting time for patients and for doctors. We're at the edge of an entirely new millennium of improvement in healthcare. So I'm very excited about it. It's so unfortunate to see the anti-vax movement just continuing to disparage mRNA-based vaccines incorrectly with false information. And it's really, they're just being left behind. The world is moving forward, as you suggested, and they're just being left behind somewhere back around with a level of understanding that's kind of what you would have expected in the 1800s. These people are 100 or 200 years behind the scientific community in their thinking, their level of thinking. And as time goes by, they're just going to learn the hard way. I think it's going to be very difficult for some of the anti-mRNA people in 10 years from now, when they're getting mRNA-based vaccines to save their lives, they're going to have a lot of a lot of rethinking to do. So that's basically my comments for today, and I'm happy to entertain questions and some further discussion.
You said 1800s. It's more like 1700s because George Washington,
Yes,
the Revolutionary War, smallpox was hurting his army more than the British, and so he had his troops inoculated.
yes. I was just trying to be kind to them. They're so kind to me, so I thought I would just return the favor.
So I have a personal stake in this. 5 years ago, they pulled a little tumor out of my kidney, and then like 2 weeks ago, they found another little tumor right where the first one had been. And so I got 5 years, and I said to the doctor, look, if I get another 5 years, you pull this tumor. He goes, yeah, everything will be different in 5 years.
Yes, everything will be different. And cancers like renal cell carcinoma are very difficult to treat and very frustrating and not uncommon. And if we could teach the immune system how to recognize renal cell carcinoma and employ the power of the immune system to help defeat that disease, that would be great for you and for everybody else.
It's safe as long as it stays where it is. Once it gets loose, once it metastasizes, then it's a bastard.
I've treated many people with it. I know.
So mine's, still staying put. And we're hoping, that we can. But Jimmy Carter, 9 years ago, had cancer in his brain, liver cancer that had metastasized. They hit him with immunotherapy.
Right.
And he's still alive today. And I looked it up. They treated him with Keytruda. And if you watch the news, like MSNBC or Fox, whatever, you see ads for Keytruda. It's mainstream treatment now.
Yes, immunotherapy is already here. It's not science fiction. We already live in an era with immunotherapy and cancer treatment. Yes.
And like when you think about what kills you with cancer, I might have it wrong, but it spreads throughout your body, and then it takes up space and resources.
There's a lot of ways cancer kills you. That's certainly true. That's one.
But if you can tamp it down, even if you if you can just you don't necessarily, I mean, it's great if you can eradicate it, but if you can just hold it down and stop it from going wild, you can live for a long, long time.
That's why immunotherapy, for example, in metastatic breast cancer has really been revolutionary. There are a couple new drugs out in the last few years that have really changed the prognosis for these women. Before these immunotherapeutic approaches in metastatic breast cancer, average median survival from time of diagnosis of metastatic disease was about 3 to 5 years. It's much longer than that now. We're seeing women with metastatic breast cancer living much longer. These immunotherapies are really an important adjunct to our therapeutic armamentarium.
So the last time I checked, it was like the 5-year survival rate was 97%. And I was shocked to see that with breast cancer, you'd have such a long survival rate because a friend of mine has it. Now, glioblastoma, I had a client who died of that. And pancreatic cancer is like a death sentence.
It's like
is there a development on pancreatic cancer as well in terms of these new vaccines?
Yes, there was just a study. I can't quote it right off the top of my head to the citation, but I just read a early study just last week of messenger RNA-based vaccination in pancreatic cancer with very good results early on. This is an early clinical study. Got a long way to go before it gets to,
I know the numbers from that study. They took 19 people with pretty much, I mean, if it's pretty much end stage if you have it at all, with average lifespan of like 10 months. They took 19 people in this stage and they pulled their cancer cells and they developed personalized immune cells using their own immune system so that their body could grab on and attack. So by the time it takes, a few weeks to mix up to make the new cells. So out of the 16 people were still alive to get the treatment, and it completely cured 8 of them, which is unheard of.
Unheard of. And I want to amplify a point you made, Rick. Very good point. Thank you for bringing that up. mRNA allows for personalized treatment. What do I mean by that? Every cancer cell is a little different. Sometimes within a given tumor, each of the cells within the tumor can be genetically different and express different antigens. That's what makes treating cancer so complicated. Well, with messenger RNA, we can teach your body to produce antibodies specific for your particular cancer cells. It's absolutely individualized. You think back to the era of just chemotherapy, where we used cytotoxic drugs, kind of like a sledgehammer. Now we're using surgical precision, laser precision, almost like laser guided, individualized. They're not truly laser, but I'm just using it kind of figuratively. Laser guided, specialized, individually developed antibody responses to your particular cancer. That's an astonishing thing to think about. It's really 21st century stuff.
Can I try to explain the game of immunotherapy, which is,
please.
All right. So all your blood, your blood has a lot of stuff in it, including antibodies, and it leaves your heart via big fat blood vessels. And then as it goes through your body, it has to get oxygen to every cell in your body. So your blood vessels branch into smaller and smaller vessels. So all the stuff in your blood gets mushed up eventually against every cell in your body. And it's by feel that if your antibody is pushed up, via circulation against a cell that it knows is bad, it'll go crazy. It'll grab on, it'll engulf it like an amoeba, like a blob, and take it out. Is that?
You just took me back to my childhood when I saw that movie, I think The Invisible Journey or something. Where
Fantastic Voyage. They shrink down a spaceship and they send it through the body.
But your point is well taken, Rick. It is really exciting. Nick, this is a very exciting time. And it just breaks my heart to see otherwise well-intentioned people being so misled and full of misinformation that they're getting this all wrong, and it's holding back progress. Let me give you a great example. I don't know if this podcast will ever be seen by Megyn Kelly, but I just saw a little broadcast of Megyn Kelly today where she said some truly astonishing and sadly wrong things. She said she regrets getting the COVID vaccine because she doesn't know what it did for her. She ended up getting COVID anyway several times, and it was no big deal. So she doesn't understand why she took the vaccine and what it did for her. Right there is a misunderstanding. The reason why, when she got COVID, it was no big deal, is because she had immunity. The vaccine gave her some protection from severe disease. It gets at a core misunderstanding. The purpose of the COVID vaccination is to prevent death. The secondary purpose is to prevent you from landing in the ICU on a ventilator, on dialysis, and ECMO for 3 months. It's nice to prevent all disease, but preventing death and severe disease is what we are all about. So Megyn Kelly gets COVID. She said it was no big deal. She doesn't realize that's because she was vaccinated. Then she went on to say something even more disturbing. She said, I went to the doctor and now I tested positive for an autoimmune disease. And she, in her mind, links these two together. I can only speculate, but I suspect she had a blood panel and showed a positive ANA, and now she thinks she has an autoimmune disease. Let me just clarify something about the ANA. It doesn't diagnose autoimmune disease. It is a blood test that is very commonly found at low titers in women. You find it probably 20, 30, 40% of women. If you test their ANA, it's going to be a 1 to 20, a low level, or 1 to 40, a low level titer. Doesn't mean they have autoimmune disease. And one of the big mistakes that doctors do is they test for it. And unless you have the symptoms or signs of an autoimmune disease, you should not be checking ANA. You're going to confuse yourself and the patient. So my presumption is she probably had an ANA, and now she thinks she has an autoimmune disease, and she's blaming this all on the vaccine that she didn't think she benefited from when she did. And this goes out on cable news to millions, and I dare say tens of millions, hundreds of millions of people around the world. And it's so sad because it's all misunderstanding. It's all misinformation. It just shows you the extent to which and the success that the anti-vaxxers have had filling the country with misinformation.
Can I talk about how COVID works versus somebody vaccinated? So if you get infected with COVID, your COVID hijacks your cells and it makes trillions of copies of itself.
Correct.
The cells fill up with these, they explode, they release more of these, they infect more cells. And COVID is a disease of clotting and information. These things spread throughout you. They gum everything up. They cause, they get in your muscles. They get like we have, some people say we have 20 million Americans with long COVID now. It's hard to measure, but you don't want to get a super bad case of COVID. But the deal, if you're vaccinated, then when you get hit with COVID, instead of your body taking 2 weeks or 10 days to figure out what to attack, during which time COVID has run wild in you, your body immediately knows what to attack, and it takes out the COVID, before it can make trillions of copies of itself.
You said it exactly right. You said it in layman's terms, and you described it exactly correct. That's what vaccines do. Another thing that people don't realize is that when you get an overwhelming viral infection, the virus triggers a 5-alarm fire in your body. Your immune system goes crazy and produces all kinds of things to try to get rid of the infection. And much of the pathogenesis of the disease is due to the body's overexuberant immune response. So when people say, I don't want to take that vaccine, I'd rather deal with the virus, they have no idea what they're saying, because when you get the entire virus, you're going to have a tremendous immune response. The immune response is what gets you sick and will kill you.
So I've got a question based on my Trumpy friend says, you don't want to get the vaccine because it takes away resources from other immune responses in your, that it's so busy looking for COVID that other diseases can escape.
That's just wild imagination. There's no evidence to suggest that. There's there's nothing to support that. That's what do you expect from Trump or any of his supporters? They're not living in a rational world.
Well, what gets me is this Megyn Kelly person. What medical degree and what college did she go to?
Oh, Megyn Kelly's she's very intelligent. I have enjoyed her commentary over the years. She's a lawyer. She trained in Albany.
She's like me, a lawyer who's pretending to be a doctor.
Well, but she's look, just because you're people have to recognize that these are all very complicated fields. You can't be a lawyer without going to law school. You can't be a doctor without going to medical school, and you can't be an infectious disease doctor unless you've done an infectious disease fellowship.
So with Megyn Kelly, she's been immunized against common sense because in her circulation she bumps up against all sorts of right-wing lunatics. And they tell her what to think, and she ends up believing a whole lot of nonsense.
This gets right back to something I've talked about before, which is the fact that, how did Megyn Kelly get so filled with misinformation? The reason why is because of who she's listening to. And who is she listening to? It's the people that are getting on TV, on Fox News and in social media and at other conservative outlets like Newsmax and Epic Times. And these people that there's, especially Fox News, putting out there as experts aren't. If they just vetted their CVs, they would find out these guys are frauds. So they're taking doctors who have invented titles, invented positions, invented faculty appointments, loaded it up on their resumes, are not true, and now they're on television and they're being put out there as experts and authorities. I'm sure Megyn Kelly has no idea that the people she thinks are experts are fake. That she hasn't done primary source verification on their CVs. She should.
So my Trumpy friend tells me about all this stuff that has to be true because somebody said it in a congressional hearing. But the deal is the lunatics in Congress hold hearings and they invite other lunatics to testify. It doesn't make what they say true.
Okay.
None of the people. I'm sorry.
I did a quick check on Megyn Kelly, okay, because I could look at Wikipedia very quickly. See, she went to Syracuse for undergraduate, was good. Then she went to Albany Law School. Let me tell you something. Albany Law School is not even a top 100 school. There's only one reason you go to Albany Law School. You can't get into a major university, which means there's only one reason you can't get in. Two reasons you can't get a major university. Your grade point average sucks. your LSAT scores suck or a combination suck. So she's not definitely the best and the brightest. So it wouldn't surprise me she'd come up with these opinions, because I know some people that teach there. It is not even a top 100 school. It's like,
so she did one heroic thing. She's the one who spearheaded, I believe, leaving Fox and then suing Fox because she said it was a hotbed of sexual harassment. They made the movie Bombshell about the whole deal. So that convinced people, libs like me, oh, well, she must, be like full of good thinking now that she's left Fox. No, she's still full of like ridiculous thinking. Like when she goes on a few years ago, she said, Santa Claus is white. And it's like, well, Santa Claus doesn't, well, sorry if there are any kids listening, he doesn't exist.
I just wish I could have 10 minutes with Megyn Kelly one-on-one to talk to her about the experts and go over their resumes with her and show her where the resumes are lies.
Dr. Patton is a good lawyer. What they do when they're in trial, they get what they call SMEs, subject matter experts, to testify on a particular topic. Mm-hmm. And when you're talking about medicine in general, not even specifically oncology or immunology, you're looking for an expert on that. She didn't qualify as an SME on anything, and so to her to make a what I call a glib opinion relating to a medical opinion is just, and people listen to it, is just dumb.
She's telling her story from a patient's point of view, but it's just so sad to see patients being misled like this, and they're being misled by doctors who are frauds.
Yeah, well, I think I would summarily dismiss these people, instead move on when it comes to science, because once they do get glioblastoma or they do get pancreatic cancer, the first thing you're going to look at, if they want to live, it's like, come with me if you want to live, is going to get these vaccines, because otherwise, the death rate is, the numbers I get, the death rate's extremely high in these things.
Yeah,
so,
these are really bad cancer. So we're coming up at the end of the time here, but I just want to say we're coming back to where we started. I want to say it again. Messenger RNA-based vaccines won the Nobel Prize. Dr. Carrico and Weissman, who developed these vaccines, this is going to revolutionize the treatment for many diseases, many cancers. I think the future is very bright for patients who are dealing with this. If you can just hang on a few years, the things are going to be very different.
Off of that, I follow a lot of lunatics who want to live forever. And the main lunatic, the most famous one, Ray Kurzweil, said, you don't have to live forever. All you have to do is live long enough for the next thing to come along to save you.
I think he does have a point, but I think this is a very exciting topic. I know that people that are listening to this, because we're beaming into the executive suites, they're seriously interested because they don't get this information, and certainly major media doesn't get the information right. So I say thank Dr. Patmos and also Rick Grosner, and we'll see you next week on Medicine and Science on the Pod TV network. Till then, take care and be healthy. Bye-bye.